Accurate and timely provider enrollment is crucial for healthcare organizations these days, mainly because if you don't do it correctly, you don't do it timely, you're leaving money on the table. We talk to healthcare administrators throughout the country every day that still are unaware or don't realize that they should be and could be enrolling all these providers and billing for all the services. A lot of the CFOs throughout the country, every single one of them, are looking at the line item around labor expenses. When you think about contingent labor and locum tenens physicians and clinicians, it's easy to just look at the cost and what that cost looks like on our financials, right? But there's a whole other factor when you enroll properly and you have an enrollment process that you follow and do it in a timely manner. You can be reimbursed and bill for all the services and all the procedures and everything that happen when the clinician's on site. And so it's not simply a cost, simply an expense. It really should be coming back to you. There should be a reimbursement. There should be return on that investment. I've seen some really shocked faces when we've talked to some of our clients, and they realized that they had been using, millions of dollars worth of labor that they could have been billing for, and they just left it all on the table, and it's too late. Depending upon how much an organization is using locums clinicians, it could be a $10,000 problem, could be a $10 million problem, depending upon the size of the organization and how much they're using locums. I definitely think that this contributes to the misconception of locums being just too expensive. It's just not something that we can bring on here in our organization. But when you really consider the return after you properly enroll and bill those payers, and when you really think about the number of patients you'll be able to see and not lose to your competitors when bringing on a locums clinician to fill in, this is a big revenue driver to offset that cost and offset those expenses to really help kind of grow the bottom line and help with those margins that are so tight in healthcare.